This is a mental health PSA brought to you by Sarah Shaka,
Alyssa Hunsaker, Sarah Goff.
Mind your health.
It's not just physical.
Mental health includes our emotional, psychological, and social well-being. It affects how we think, feel, act, and handle stress, relate to others, and make choices. Mental health is important at every stage of life.
According to the National Alliance of Mental Illness, did you know that 1 in 5 teenagers ages 13 to 18 have or will have a serious mental illness? Mental health is not prejudiced to gender, race, social class, ethnicity, or income. Anyone can suffer from mental illness.
Because of lack of education, many people do not understand that mental health is real. Just because it is something we physically can't see or control doesn't mean that it's not present in our everyday lives. 50% of all lifetime cases of mental illness begin by age 14 and 75% by age 24. The average delay between onset of symptoms and interventions is 8 to 10 years.
Approximately 50% of students age 14 and older with a mental illness drop out of high school. 70% of youth in state and local juvenile justice systems have a mental illness.
According to the American Nurse, many people do not seek help until their symptoms are so acute that their judgment and behaviors are affected to the point that they may require hospitalization.
Suicide is the third leading cause of death in young ages, 10 to 24 years of age in the United States. And one of the worst parts about this is that suicide can be prevented with the use of many different resources.
Here in Tyler, we have a couple behavioral health care systems, including the Andrews Center. They treat mental illness, mental health, and addiction services. 90% of those who died by suicide had an underlying mental illness.
If you're not sure if you or someone you know is living with mental health problems, experiencing one or more of the following feelings or behaviors can be an early warning sign of a problem. Eating or sleeping too much or too little, pulling away from people and usual activities, feeling numb or like nothing matters, feeling helpless or hopeless, smoking, drinking, or using drugs more than usual, having persistent thoughts and memories you can't get out of your head, hearing voices or believing things that are not true, thinking of harming yourself or others, or inability to perform daily tasks like taking care of your kids or getting to work or school.
If you would like more information, you can contact the Andrews Center, Tyler Counseling and Assessment, Suicide Prevention Lifeline, or the National Alliance of Mental Illness. Mind your health.